everybody, Dr. Rocky here. Today we have a interview with Dr. Phillip, so we're just gonna wait a little bit so she can get on. While we're waiting on her to log on, I just want to show you guys this shirt. So I know I posted a picture of it, but here's what it actually looks like. So you guys can see the queen, the doctor. We got the stethoscope here. We got the big fro. We got the crown because, we're all doctors and we're queens, right? Hey there, Miss Magdalene Peach. Thank you for joining us. We're about to have our interview with Dr. Phillip, so hopefully she'll join in soon. And we have so much planned for this year, and we're excited. And Dr. Lindsay Banks, who was on last time, we're going to be working together, so you won't have to see my face every single time. Next time, or not the next time, but in February, she will be doing some of the interviews. So I'm excited about that. And I'm just going to show you guys again this shirt. It's a sweater, actually, huh? I'm wearing a sweater. I actually have this on a t-shirt as well. And I decided to put my business logo on the front. So if you want one of these right here, just let me know and we will get you one. Let me see. Let's get the doc in. We're gonna ask her to join. Your request, so you should get it soon, so we can get started because I know you gotta work. Hey, how are you?
Hi. Oh, I'm so happy to be here. Can you hear me okay?
I can hear you just dandy.
Oh, wonderful. I'm so excited about this.
I'm excited too. Thank you. You're number 2 on the interview process in our interview train. So we're kicking off Black History Month on a great note.
Nice. And happy National Women's Physician Day to you.
Oh, I did not know that. Happy National Physicians Day to you too. Women's Physicians. That is awesome. I didn't know that, so I'm going to have to make a post about that because we're all women physicians, right? So let's go ahead and start with talking about yourself. You can go ahead and tell everybody your name, where you're from, and your specialties.
Yes, so I am Dr. Mariel Phillip. I am a chiropractic physician here in the state of Rhode Island. I currently practice in Providence, Rhode Island, and I've been practicing for over 12 years now. I can't believe it. I love what I do still. You find some newness to it each year that you go, and each time you learn something new. But I'm happy to be here. I graduated from University of Bridgeport Chiropractic College. The name has changed since, but I graduated in '08. And here I am. My specialty is the spine. So I'm a spine specialist. I do not turn away a spine, whether it's older person, geriatric patient, or a sports buff, an athlete. My son is 11, so children, I include them also. I also include acute injuries, personal injury and chronic pain syndromes. I welcome everyone, and I'm here really to just teach what I know. I don't know everything, and I'm still learning, but it's really just a great platform in chiropractic just to engage folks and encourage them in being healthy.
I love that you said you treat anyone with the spine. That is awesome. That's everybody. We're not leaving anybody out. If you have a spine, come on down.
Come on in. I'll try to help,
Yeah, I really love that. So you're going to have to tell me, where exactly is that college located? Because I had never heard of it until I saw your bio.
Actually, a university program. So it's in Connecticut, in Bridgeport, Connecticut. And it was the first university-based chiropractic institution there. The name has changed recently. I think it's more health sciences because now they have other health programs, physician assistant and some other programs at the school itself. But yeah, so it's in New England.
Yeah, awesome. I was like, oh, I've never heard of it. I've only heard of like a handful. And to be honest, it's because those are the ones that participate in Chiro games. And I went to Chiro games, so I got to see all those different schools, and that's how I knew most of my schools. I'm just going to be honest.
Oh, nice. Yeah, so we're there. Put us on the map.
Right, yes. Woo, woo. So I guess one of my questions for you, a big thing that I'm just asking pretty much everybody as we interview is how does it feel to be essentially a double minority in a profession? Like it's kind of hard. We're slim to none, I feel like, in the profession, but we're out there and we're great because we're amazing. So how does it feel?
Yeah, I would say I think it puts us in a special place because, we're gems. It's not many of us out here. Even when I was in college, there was maybe one or two others that didn't complete the program, but there was one other minority woman that I went to school with that I know, and it's really hard to connect with others when you don't know where they are. So I have to
Hmm.
appreciate your platform that you've actually, created here, because I think this is a great opportunity for us as Black women to connect, to share what we know. I do know that there's the American Black Chiropractic Association also, but there's some that maybe don't know about it. So how I feel, back to your question, like I said, I feel special. I feel like we have a special place. And I think we can communicate across the board, just a little differently than most.
Right. So do you think, like, what are you doing? I don't know if you are, I'm just gonna ask, like, what are you doing to kind of help the community, people of color to get into the chiropractor, to kind of let them know that we're not gonna hurt them, we're not gonna injure them, that this is kind of one of the best and safest routes when they have some of these back conditions versus going and getting medication.
Right. I think the best way is really being involved in the community. So education is key, and seeing a face that they can, that resembles theirs, that the voice is familiar. So, social media is great, but when you're face to face, COVID is not always the best situation right now with COVID. But even community service is a great way to do that. And telling people, not being afraid to say, hey, I'm a chiropractor. I like to tell people I walk with my tools. These are my tools. I walk with them. Come and talk to me if you have any questions. I'm here. So I think the main thing is being out in the community if you can. Find an organization that you can connect with, and it's really word of mouth.
Hmm. Yeah, no, that is so true. Do you have any words of wisdom for any upcoming chiropractors? Women
Oh,
who are in the program, women who might want to get into the program. What do you have for them?
that's a great question. I would say listen to your intuition, stick with what your gut is telling you because it's always right. And if it feels good, then you're going to do good. There may be ebbs and flows, as you go through the program, even when you get out in practice, but there's so much benefit to it. So always look for the end result. There's so much benefit to it, and you are creating a path for somebody who may come behind you. So stick with
Right,
it.
right. That is the biggest thing. Stick with it. Don't give up. It's way worth the journey.
It
It's way
is.
worth the wait. It's way worth the struggle, the ups and the downs. It's way
Yeah.
worth everything.
Yes, it is,
So,
I believe it.
what are some struggles that you feel that you have had that you might have wished that you had some guidance on so that you can maybe give some guidance to not only future docs, but docs that are out there right now that could be going through these same struggles that you've had and you've overcome?
I would say starting in practice, like from scratch. In university, we had like a basic business class. So there are some things that happen in the world that are not in the books that you have to learn how to maneuver. So I would say find a mentor, even before you graduate, someone that you can really trust that will be honest with you and let you know what steps you need to take if you decide to go out and practice independently. I did get the opportunity to go into practice independently early on. And when you wear all the hats, you are doing billing, scheduling, adjusting, like you are the mother octopus. Your tentacles are everywhere. It can become overwhelming. And I think us as women, not only in our business life, but even in our personal life, sometimes we do a lot for everyone and we don't always focus on ourselves. So I would say definitely get a mentor, you know, get your mind right. And, you know, things fall into place.
Yes, I think that that is a good thing. I remember when I was a student, um, I had a mentor, but I didn't take it as seriously as I wish I would have. Like
Yeah.
I didn't take advantage of those opportunities. I used to look at I was an untraditional student, so I was a mom when I was a student. I was a wife, but um I didn't take the opportunity seriously. And there were other people in my class that they had all these mentors, they were doing all this stuff. I was like, I don't have time to do all that stuff. I can't
Right.
do this and I can't do that. But then now looking back at it, I'm like, I wish I would have took those times to learn from those people so that some of the trials and tribulations that I did occur after I graduated wouldn't have happened because I would have already been working through that as a student.
Right, right. I agree. You know, and again, we take a lot on, and I think it's just natural for us to want to do that, but we have to fill our cups first.
Right. Yeah, that is a big thing to take care of ourselves, but it's hard. It's hard to take care of ourselves because as a chiropractor, as a woman, we want to take care of other people.
Right.
So that's it. What does it say? Do you all prefer any particular adjustment techniques? I'll let you
That's
answer
a
that
great
first.
question too. Yeah, I
Yeah.
prefer diversified because you have, especially when you work with a range of individuals, you want to make sure that you can accommodate, you know, the correct adjustment for that person. So I use activator, you know, again, diversified adjustments. So I don't stick with just one thing.
Right. I feel like I'm the same way. So I do diversified typically, but I also do drops for the low back because I feel like that's a little bit more specific than side posture. And also I'm not trying to hurt my shoulder over
Right.
time.
Right.
And then I also like SOT. So Miss Magnolia, if you've ever taken ST or heard of SOT, I highly suggest it
Yeah.
because if you have anybody that suffers with headaches, and let's face it, that's a ton of people in this world, right? A ton of
Yeah.
people have headaches. They suffer with headaches. If they suffer with TMJ issues, SOT will help them knock that out. And it's something that a lot of people don't do. I don't, have you taken SOT?
We did a brief stint, and I do use the pelvic drop, the pelvic blocks rather. But yeah, we had some of that, but it wasn't like a main focus. So I have
Mm-hmm.
a little knowledge on what to do with using SOT.
So I took the extra SOT classes, coursework afterwards. I don't know if your school offers this once you get to a further up in the trimesters and you're like a intern, you get to take extra technique classes. So SOT was one of the ones I took. I took activator as well, so I know how to take activator. Um, I don't know what tonal is. Maybe she could answer you that. I'm sorry. But so we did a lot of cranial work. So
Right,
that's really working with the sutures in the skull and working with the points right here, working with the sinus pressure,
right.
working with the TMJ. We did a lot of those in the musculature of the TMJ. And when you think about it, like people have problems with their cheeks, so they have problems with the TMJ. And
Right.
I ask them, when's the last time you've had your cheeks massaged?
Yes, I do that.
And
It's
then
not always comfortable, but it works.
no, yeah, and they're like, I've never had my cheeks massaged. I'm like, exactly. That's why they're so tight. That's why your jaw is hurting so bad because that's all muscle right there. You don't think of your cheeks as muscles, but that's all muscle.
Also, correct. You know, I mean, like the profession is so diverse and unique. There's so much that we could do.
Right,
So, yeah,
right. And there's not, and Miss Magnolia, just to let you know, there's no one technique that is correct. Everybody has different techniques and they all work in their own sense.
right,
But the best thing in my philosophy typically in life when I'm treating patients is I like to treat patients how I like to be adjusted. If
right,
I don't like that technique, I typically won't do the adjustment just because I've either found it might hurt or the adjustment doesn't last very long
right.
or I get a little bit sore. Like there's just different things you can think about when you get those adjustments and how it makes your body feel. That's how I decided when I was in school which adjustments to use later on.
Right, right. I agree totally. You know, you want to keep yourself open. It's great to learn a little bit of each thing. That way you can apply it when you need to for that special, you know, patient that might come through the doors.
Right. Do you know what tonal is?
I'm not familiar with it. No, I'm not actually. So I don't
So
know if
Miss
that's a
Meg,
soft tissue work.
I have no clue. I'm
Yeah.
not even gonna act like I can make something up and say it.
Yeah, that's a new one. That's a new. I might need to learn about it though.
Right, I know. That's what I was just thinking as well. Maybe you could teach us something, Miss Magnolia. Maybe Miss Magnolia, you could be one of our student interviews in the
Yes,
near
please
future, so
do.
you can teach us. Yeah, networking spinal BGI. I guess that's what tonal is. No, I have no clue.
No,
Yeah,
yeah,
I still.
that must be something new.
Yeah, you're gonna have to come on here within the next couple of weeks so you can teach us on what it is, because I'm sure if the two of us don't know, there's probably more people that don't know what it's all
Clearly,
about, and we need to learn.
education is key. Yeah, education is
Yes,
key.
we're in this field. You're constantly learning. It's not something that once you get out of school, you're done learning, because there's so many different illnesses and sicknesses that you just don't know about.
Right,
And
and you
when
are
they walk through your
relearn.
door, yeah, you have to relearn, and you might learn it for boards. But sometimes when you're bored, you just dump it. You just, ugh.
Right.
So, and then that patient that was on boards walks into your door, and you're like,
Oh yes, yes, it happens.
like, what do I do? So we're constantly learning, and I would love to learn from you, Miss Magnolia. That sounds good to me.
Yeah, let me know when she logs in, you know, for that next interview.
Yes, because I want to also, we're going to do students. So we have to have students in here because they have to tell us what's going on in the world today of being a student, because we've been
Yeah,
out for a while.
right. We need to
It's
learn
a
from the
little
young ones.
different.
Mm-hmm.
Right. And like you've already said, you didn't have that many women of color in your classes. I didn't either. I
I ended
think
up being the
was,
only one.
there was me and one other woman who graduated together, but total of anybody in color, I think there's 3 or 4 of us total. That was men and women that graduated in our class. So it was not very big, and you don't realize that you really need a community when you're going through school, because it's really hard. It is.
It is.
And sometimes it's a little bit easier when you have a community it looks like you and it's kind of like-minded.
Right. I agree. And they, you know, teach you a few things also that you may not hear in that room setting, you know, but we learn
Right.
them along the way.
Yeah. And Miss Magnolia, you are welcome. We are happy. That's what this group is all about. Just to teach everybody, to teach us, teach you, teach whoever wants to
Yes.
come and listen and learn. And we all have different practices. We have different styles. How about can you just give us a quick view? I know you said you had to get back to work soon, or you have to get back to work around 2, but how does your patient flow work? Let's talk about that. I think that's really good to see, like, because everybody has a different patient flow.
Yeah. So my patient flow, like I can actually, you want to see like what the space looks like?
Oh yeah, you can take us and give us a quick tour.
Let me see. So I'm kind of plugged in here. So I have a bunch of plants too, but basically this first table here is basically my intro. And what I do with that wheel is just a spinal flexibility wheel. And I kind of walk people through that. On the other side, which I can take you to, whoop, here we go. So this is like my money maker. So this is my flexion. There's a flexion piece here.
Mm-hmm.
There's also a drop that I do
Mm-hmm.
on here. But it's just, basic me using my hands, using the table for most of my work, and also the activator. So now
Yeah.
with COVID, clearly I don't have many people in at one time.
Mm-hmm.
So, and the space will accommodate that also. But the flow is comfortable because it's really an intimate setting. There is, no onlookers. I get to have time with the patient, and I really get to know what their need is.
Right. Oh, that's awesome. That's really awesome. Thank you for sharing that because it looks like your office is like a one room, right?
Right. Yep.
Yeah. So that just lets us know that there's no cookie cutter to how you can run your practice.
Right. And that's the
There's
big
there's
thing. You can start any size you want. I
right.
consider this more like a boutique practice. And again, it's
Mhm.
really hands-on and I'm really detailed also because you're going to get that one-on-one and it's not necessarily rushed. So I can really address the concerns of that individual.
Right. And I will say I like having a practice that's not rushed because um you do get to do, hands on, you get to really educate the patients. Like almost every single time they come in, they're learning something new. And
Correct.
you're not just I don't know, I'm not saying anything about anybody who likes to do it like this. I was not a fan of high volume. It was too much on my body. It was just
Right.
too much. I couldn't handle it. Yeah, I like the lower volume, higher quality patients. Like I like that. And you get so much more education versus if you just 1 or 2 minutes, they're getting their adjustment and they're leaving. And if they have any questions, you really don't have time to answer their questions in
For
depth.
sure. Yeah, for sure. It's all about education. I mean, people want to leave from you knowing that you helped them and that you've left something with them that they can take back and they can possibly share that with someone that they know. I mean, again,
Right,
education is really the key.
right, exactly. Dr. Moy and Dr. Lindsay, you guys are so right. Like we're all on the same page. It's about education. The more you educate the patients, the more they are willing to keep coming in. The more they are like, oh, I have my back starting to hurt a little bit. Let me go into the chiropractor instead of let me go into the MD to go get medicine. Like you have to teach them why it's
Right.
so important.
Right.
We can
I
have a powerful,
agree.
profitable, low volume practice. Exactly. That is so true. You don't have to kill yourselves. None of us do. Some of us do, but you don't. If that's what you want to do, that's what you want to do.
Right.
But
And I
I'm
think
not
it's
here for it.
okay. I'm sorry, not to interrupt. I was going to say, I
No,
think
so
it's okay to experience high volume.
yes, it
Your
is.
family did. I think it's a good opportunity to really just see the different styles of practice because eventually you're going to figure out what works best for you. And again, this is a physical profession.
Job.
Our bodies,
Mhm.
we have to take care of this temple also, not only there. So do we want to break ourselves down? Or do we want to kind of grow with the people that we have coming in?
Right. No, exactly. So with going to low volume, I worked at two low or high volume practices, and I will say that in a short span of time, my adjustment skills they got on point being in a high volume.
Yeah,
like
that's the
like you
benefit of
learn
that.
so fast.
Yes, I
So I think
agree.
that it's important for that aspect. And like you were blessed enough to go straight into your own practice, but I wasn't able to do that. So I did work in two high volume. One was a pain management clinic, and then one was the joint. And those are two very high volume places. But let me tell you, my adjustment skills have been honed. They are good. So now for my patients at my clinic, I know I'm gonna be able to I'm gonna figure out how to get almost everything to go. Sometimes you just have to wait. Oh, no,
Right.
technical difficulty. Let me put
That's
the
all
other one
right.
in. Sorry, because it's definitely all the way on the ground, and I'm not reaching down there.
Oh,
Um, technical difficulty, my bad. But anyway,
okay.
so my skills have been honed, and it's great for when you're in your own practice because you know how to handle a whole lot more than
You
if you just
do.
had a low value practice the whole time.
Yeah, you do. And I also worked as an independent contractor. So that was my insight in seeing how different practices run. How they
Mm-hmm.
had the intake process for patients, the office flow, office management. So, I mean, especially if you're a woman and you plan on having kids, or if you have children, like being able to, work and manage, childcare, school pickups. I think it's great to, again, see the different styles of practice, figure what your schedule will be if you decide to go in on your own. But it's a
Mm-hmm.
lot of diversity with that.
Right. No, it's so much nicer schedule, be able to fit your schedule for your family. Because like in the beginning of COVID, I worked for someone and I wasn't able to do my schedule how I needed to do it. And I was never able to really spend time with my family, even though my family was home all the time because school was closed. And that's when on, and I was like, I need to be home. I need to be able to take care of my kids as well as take care of patients. So I need to figure something out.
Yeah, for sure.
Mission trips. I would recommend it. I've never been on one, but it sounds amazing. I want to go on one now. What about you?
No, I have not. I've heard of a few, but I never was afforded the opportunity, and I enjoyed taking trips too. But maybe one day that would be awesome.
Yeah, I think that that's awesome. I did do a mission trip for church one time, and
Okay.
and that was great. It was a great experience at a church. So I can only imagine if you're actually in there and you're helping people to heal and helping them to get better doing a mission trip. That sounds amazing. If you know any, pass them our way so we can share it with everybody so
Please
that we
do.
can start a mission. Maybe we can start our own mission and go somewhere. I don't know. I'm just throwing it out there.
I think we can.
Right. Just go somewhere.
If you put it
Right.
out there, it could happen.
Right. So I don't know. We'll just have to see. Is there any other questions, comments, or concerns that you wanted to discuss before we wrap this up?
No, the only thing I would like to leave with is, at least for my practice, pain affects so many different things. It affects your activities. It affects how you make money. Pain affects, your emotional well-being. And also socially it could affect you. So being a chiropractor, my job is just to fulfill those areas in relieving that pain so that, your spinal health is being maintained. Exercise is important. So I want to encourage movement and nutrition. And also mental health is also something, that we hope that we can also help people ease on their own or through us. So, I really want to leave that with everyone. Just, find what your purpose is, and it really makes the profession and make your skills improve and your knowledge improve.
Yes, that is awesome. So I like that you touched on mental health because you don't realize until you're really in practice that some of these people, they don't never see anybody, especially right now in COVID. You're the only people they talk to.
Yeah.
So they need that talking and they need to just say whatever is on their mind so that they can make it through the day and make it through the week for that matter, because you're their only lifeline.
Yeah, and it's power in touch. Right now I wear a mask,
Right.
I wear goggles, I wear gloves, but there's power in, positive touch clearly with what we do. But yeah, we're a source of venting sometimes too.
Right, exactly. Because I hear a lot of stories and I'm like, oh, yeah, girl. Okay. Yeah, okay.
Oh, yes.
So I did see some comments up there from Dr. Moy, Dr. Lindsay, and Miss Magnolia, and we're definitely going to try and work on getting a mission trip. I think that's something we're going to have to focus on,
Yeah.
and we're going to be out there and get in there and do something. That's so exciting. I'm telling you guys, this group is going to be huge. We have so many big things lined up. Dr. Banks is helping me a lot with everything now. We just started getting the ball rolling, and we're really, really getting out there. So I think that's it for this interview. I do have one more thing I want to do before we get off, and I know it's going to seem really silly, but it's really hard to find a cover photo. So what I want to do is just take 2 seconds for us to both smile so we can get a cover photo. So let's just smile really quick. Okay, I think that's good. And one more thing before we go, you guys, if you guys want a shirt like this or a sweater, just let me know because we are Queen Doctors. It's looking like Dr. Phillip's hair right now, don't it?
Yes,
Look.
that's me. I love it. I love it.
So this is going. Okay, just post it in the message, just send a message, and then we'll get all the information to it. This is actually going to be like our shirt logo for this group. Because that's who we are, and I'm gonna make a couple other ones for all you Latinas out there, all you Chicanos, everybody, so we could all have shirts that represent us, and then we could put a CWC on the front of the shirt, so, or sweater, whichever one. This is a sweater I got on right now. So, but anyways, guys, thank you so much, Dr. Phillips, for joining us and giving some knowledge and wisdom and talking and just spending your afternoon with us.
Thank you for having me. I love it. I see big things for this. I appreciate the interview.
All right, perfect. Well, if you're interested in becoming another interviewee, just let us know. Just hit a line on that in Instagram, and we will talk to you guys later. Bye.
Bye.